Joining us now is Dr. Chikwe Ihekweazu. Despite the widespread destruction that has already been visited on Nigerian lives and property by COVID-19, there seems to be heightened apprehension since news broke that the deadly Indian variant has been detected in Edo and Osun states. We are now being joined by Dr. Chikwe Ihekweazu, Director General of the Nigeria Center for Disease Control, for him to provide more information, as well as explain how the country's COVID-19 team plans to manage the anxiety of the public. Welcome to the program, Dr. Ihekweazu. Good to have you again on the morning show.
Thank you very much, Ruben. Always great to be on your show.
Thank you. Well, quickly, let me ask. We got to know that the Indian variant is already in Nigeria and that, it poses a major threat. Only through the Center for Genomics at the Genomics of Infectious Diseases at the Redeemers University. That's the center led by Professor Christian Happy. Now, it had to take that center to make the information public. Is it possible that the Nigeria Center for Disease Control did not know about this and the Presidential Steering Committee was not aware? It had to take a research center to go direct to the public to inform us. Because, I was shocked that the information was coming from a research center and not from, the Nigerian COVID-19 team. What happened?
So, thank you very much, Ruben. I think the first thing to say is that the Nigeria Center for Disease Control has been working very hard with all its partners to mitigate the impact of this outbreak. The strain called the Indian strain, which is a little bit unfair on countries that are labeled with strains, because that it was first detected in India doesn't actually mean that it came out of India. The B1617 strain has now been found in 44 countries around the world. The Africa Center for Excellence in Genomics is one of our partners in sequencing in the country. And we have given them credit every time they've supported our work. They informed us on this 3 weeks ago. They had already gone to press on it. I have appealed to all our partners, listen, give us the information. We will use it to inform public health decisions. We use this information as part of a stream of information sources on which we base our decisions and our advice to the Presidential Steering Committee. That there's a new strain in a country in itself is not enough to make a decision. We also look at the density of travel from every country. We look at the strain circulating in other countries. We then do a risk assessment, a very careful, thought-through process within the center. Based on this, we then advise the Presidential Steering Committee on actions necessary to be taken. 2 weeks ago, they advised the country on a travel restriction to 3 countries around the world: India, Turkey, and Brazil. That public health action was taken based on the risk assessment that we did here in NCDC and advised government. Listen, Ruben, the sequencing, which is how you detect variants, is a very complex process. We have just been developing that capacity in the country. We have 4 centers with the ability to do this. EDE is the one that has the most advanced capacity. We do some here at NCDC. NIMA does some. So we've done 700 sequences across the country.
Dr. Ihekweazu, if you can hear me, we need to take a short commercial break. After that, we'll come straight back to you. Welcome back to the morning show here on the Arise News Channel. Still with us is Dr. Chikwe Ihekweazu, Director General of the Nigeria Center for Disease Control. Dr. Ihekweazu, sorry I interrupted you earlier. We needed to take that commercial break, but you were talking about sequencing and your work with partners.
So thank you very much. Yes, I was talking about the great work we've done with our sequencing partners, especially the Africa Center for Excellence in Genomics. From EDE and our own sequencing efforts and NIMA and the University of Ibadan and their partners, we get sequencing data, we analyze this, and then we do a risk assessment, and then we offer the Presidential Steering Committee led by Mr. Boss Mustafa, all this information in an organized way so they can make an informed decision. All this was done. And this is part of the information that led to the restriction of travel, the reissuance of the guidelines recently. So, you know, Ruben, let me make an analogy to the security space. It's not every time somebody reports a risk in a village somewhere in a state in Nigeria that the police goes to the press and says, listen, there's been a threat, a single threat without analysis in a single village in Nigeria. Our role is to analyze this information, contextualize it, and make sure that the right decisions are made. And I think in this case, Nigerians will bear us out, actually. That is not as if the information came out from Ede and nothing had been done. You know, the government had taken steps, restricted flight from India, reissued guidelines, warned Nigerians about the impending risk, and therefore all the actions that a responsible government should take had been taken. So I think the single piece of information on a variant being in Nigeria, is in Nigeria, but it's also in 44 other countries. The fact that that variant is in Nigeria is not in itself a reason for concern. The reasons for concern is what are we doing? Firstly, as a government, but secondly, as a people. What are we doing? There's no point running around attending weddings fully in literally super spread events without masks that many of us are doing, and then worrying about the emergence of a variant. So we're advising Nigerians, do what you can do. And while we at Nigeria CDC will continue doing our very best to protect your health 24/7, every day.
Well, thank you for that, Doctor. Still on allaying the anxieties Dr. Abati referred to, I'd like your comments on the impression that a lot of Nigerians have that the government has announced new COVID-19 regulations on Monday. That is, in fact, not the case, but I'd like people to hear it from you. It will carry a lot more weight than if I say it. And also, anxieties about the vaccination exercise that Nigeria has commenced. We've gotten about halfway through that. Is this vaccine, AstraZeneca, is it able to combat this new B1671 variant or not?
So thanks a lot, Tudun. You know, great question. Let me try and answer it in a way that I hope will get through. You know, if we look at our risks to this virus and to this pandemic that we've all suffered so much from, I like thinking about it in three broad categories. One is the risks associated with the virus itself, you know, new variants and all of that, and circulation. Secondly is how you mitigate that risk through two broad areas. Firstly is the vaccination program, which you asked about, and I'll answer. And thirdly is what people do, you know, human behavior, population behavior, and that relates to the guidelines that had just been reissued. So I had dealt to some extent with the first bit, the virus, and just to ask folk to rest assured, we're working very hard to find the viruses, sequence them, increase our sequencing capacity so that we can detect new variants when they do occur. Secondly is the vaccination program. So we got the first batch of 4 million vaccine doses. The efforts are being led by our sister agency, the National Primary Healthcare Development Agency. They have almost completed vaccinating the first 2 million people. And we reserve the second dose for each of those 2 million people. The primary focus of our work at the moment, or the work they are leading on, is to get more supply of vaccines and the various pathways for that are being pushed very hard, so we can start the next set of people. And so for the first set, we've almost completed the 2 million from in a few weeks' time, literally. Everyone that got the first dose will be invited for his second dose. And we have assured everyone that got the first dose that there's a second dose waiting for him or her. So with 4 million people vaccinated, skewed towards the states with the highest incidence. So we haven't distributed these vaccines equally because the burden of disease hasn't been equal. So Lagos, FCT, Kaduna, they have all gotten a little bit more than other states because of the burden of infection they've carried. So the vaccination program, yes, has had its teething challenges, and yes, there's quite a bit of hesitancy in the beginning, but I think we're ending strong, and the challenge now is on our side to work with the global supply chain to make sure we have more vaccines in country to give to our people. The third area was the reissuing of the guidelines. You know, those guidelines, nothing in those guidelines is actually new. What happened was we generally stopped adhering to them. Across the country, we started behaving as if nothing was happening, as if there was no pandemic, right? And learning lessons from what happened in India, a country that is very similar to ours in many ways, understanding what triggered the resurgence of cases in India. You know, it's most likely to be linked to religious festivals that brought people together, to election campaigns that brought people together, all creating super spreader events. And the thing with India is not just that the numbers increased, the numbers increased exponentially. So this really pointed to us that, listen, 1, 2, 3, 4 super spreader events happening one after the other, like happens during election campaigns or religious festivals or whatever else, Christmas period that led to the second wave in Nigeria. If we let these things happen in Nigeria, then we are at incredible risk for a third wave. And this is something Mr. President had told the PSC that he really doesn't want to happen. So we must do everything possible to prevent. So that's what led to the PSC looking through all those guidelines, reissuing them, making sure that they rise in the consciousness of Nigerians and of state government authorities, because they actually have the enforcement authority on almost all the guidelines, apart from those that relate to aviation. For all the rest of them, it's really for the state governments to enforce and ensure compliance, but also on Nigerians, because we can't only rely on enforcement. We, as citizens, need to make sure that we do our best. And so I think that has had the necessary impact. People have been reminded on what they need to do, and we hope that together, because none of us can do this on our own, not government, not NCDC, we can only sustain the very fragile gains that we've made if we continue to work together on all of these.
Right. Good to see you again, Dr. Ihekweazu. I want you to sort of like simulate a scenario. If there is a surge, in a case where there's a surge of this Indian variant, what would be the approach? Because most of the isolation centers in the States are shut down now because we don't have cases. So when there's a surge, what will be the response? Let's just simulate that scenario. And what will be, the conversation with the subnationals that will have to be on the front line of all of this? And thirdly, I'm a little bit iffy with the numbers. The progression at which the numbers decelerate is quite shocking to me. I don't know if you want to take me to the maths. All of a sudden, is it that we're not testing any longer as much as we used to test before? Because the progression of the region numbers decelerate. I just can't understand it. The COVID-19 numbers in Nigeria, that's what I'm saying.
So thanks, Rufai. Quite a number of questions. And it reminded me on a question from Tunun that I didn't quite respond to, is the efficacy of the existing AstraZeneca vaccine against the circulating strain. So right now, there's no evidence that the AstraZeneca vaccine is less efficacious against the strain from India circulating. The challenge we have is getting enough people vaccinated quickly enough in order to prevent them from having infections. And our biggest challenge with that is just the global supply chain, but we're working very hard on it. Secondly, Rufai, thanks a lot. Also good seeing you again. The challenges you talked about, enforcement at the state level. Really, one of the bright points in this outbreak response has been the relationship between the federal and the state governments in most cases. There are some cases where that hasn't really worked as well as we would have liked to, but in most cases. So we have a subcommittee of the Presidential Steering Committee that meets regularly with a subgroup of the Nigeria Governors Forum led by His Excellency, the Governor of Delta State, Governor Ifeanyi Okowa. And we speak every 2 weeks, deliberate on actions that will be taken or need to be taken across the country, talk about the responsibilities of the federal government versus the state government, and we always reach a compromise on what needs to be done. So these meetings have been very regular. The government of Nigeria is the way it is. And, there have been many conversations on your show on the impact of this on security, on just prior to this segment on the law exams, where there are always discussions between federal and state in terms of how to implement rules across the country. So the management of this response is really a collaboration with all that we do at the federal government level, but with also my colleagues, ministers at the state level, their excellencies, the governors, honorable commissioners, and their teams. To your third question on the numbers, I think I might have said this previously. I have assured Nigerians that one thing they can take 100% to the bank is that we will be as transparent as we possibly can with all the numbers, all the testing, all the sequences, whatever we can at the appropriate time. For numbers of cases that we find, we announce this every night. The numbers have reduced significantly. Testing is still fairly good. We test about 30 to 40,000 people every single week. And out of that, our test positivity ratio right now is about 1%. So 1 in 100 people tested come out positive. So we're fairly positive. We're very confident in the robustness of our numbers. And that is validated by many other data streams. The number of people that walk into hospitals with respiratory symptoms have reduced across board. The number of calls we get in our call centers have reduced very much. So there's a triangulation between the different data points that gives us the confidence in the numbers that we are sharing. Now, having said that, you're absolutely right that what happens when numbers are low is that people drop their guard. This is human behavior, right? It's very hard to manage a treatment center that is empty the first month, the second month, and there are a team of doctors and nurses, such a scarce resort, kept in a treatment center with no cases. So it's normal, it's human behavior that there will be some complacency. What we're now encouraging all the centers, listen, to manage your human resources, but to always keep some surge capacity available. We've been working very hard, the ministry and the states have been working hard to assure that there are certain aspects of treatment, and we have seen from India, oxygen supply is one critical one, that there's no way around. We have to build up our capacities. It means that sometimes things go to waste. Reagents have a short shelf life. So sometimes in order to build resilience, we buy more than we need. We know that some of those might be wasted if they can't be used by the time they have to be used, but it is better we do that and have redundant capacity in certain areas like oxygen, reagents, and things like that, than end up in a situation like in India where the system was overwhelmed so rapidly. So we keep juggling these balls and hoping that we are on top of this response.
Well, again, I need to interject. We need to take another break. But please stay with us. We'll be right back with you, and the conversation will continue. Welcome back to the morning show here on the Arise News Channel. Our guest is still Dr. Chikwe Ihekweazu, Director General of the Nigeria Center for Disease Control. Dr. Ihekweazu, thank you for staying with us. If you may just conclude your thoughts before I bring up again the issue of vaccines. Please go ahead.
So thank you, Ruben. I think to conclude on that point really is to really remember that whatever we're doing throughout this period will need to be a collaboration. The government is making some very hard decisions. Stopping citizens from another country coming into Nigeria wasn't an easy decision to take because there's so many other factors to consider outside the information that we provide at the NCDC. India is a cherished partner in Nigeria, a trade partner, a friendly country. So I can really understand the difficulty in taking these decisions. We've provided that evidence. Government has listened to us, said, listen, on the scale of what is going on now, for 4 weeks, in the first instance, we will stop people coming back from 3 countries and then reconsider after 4 weeks. But I think what government is doing is not enough. i.e. it's not enough to manage the risk of the pandemic in Nigeria. We have to do our bit to our citizens, right? So, one thing is for newspapers to carry headlines of Indian strain in Nigeria. But if you ignore, or if parts of the media ignore the mass gathering events that are happening, having people appear without masks where they should be role models for the rest of the citizenry, ignoring all the other aspects that we have to collectively adhere to manage the risks that we face collectively. I think that's where the kind of imbalance lies. So I just like Nigerians to really look at what is going on in a few other countries. Don't externalize it. Say, listen, we will do our bit. And on our side, whether it's within NCDC that I lead or within the Presidential Steering Committee, that really still meets every 2 weeks, and you can see and hear the passion of the leader of this steering committee every 2 weeks when he speaks to the country, really appealing to the hearts and minds of Nigerians to listen. Let's not drop the ball on this. We've managed to get through a very tricky situation last year. And now our numbers are low. Let's not get complacent, and let's hold on to the fragile gains by doing what we can do collectively, both as a government and as a people.
Well, Dr. Ihekweazu, we have on the screen breaking news that former Defense Chief General Dogonyaro is dead. Well, may his soul rest in peace. Now, Dr. Ihekweazu, let me come back to the point I raised earlier about vaccines. Are you with me, Dr. Ihekweazu?
Yes, I am. And
okay.
really, may his soul really rest in peace.
Amen. Yeah, I was going to ask you to give us more information about vaccines. You've talked about the safety and efficiency of AstraZeneca, but we understand that NAFDAC has also approved, is it Pfizer, the Pfizer vaccine, and there has been a lot of talk about the Johnson & Johnson vaccine, and we hear about donations from some other sources. Now, when we go into the second phase of vaccinations, do we have enough vaccines that can at least take us close to the herd immunity target that the Presidential Council Committee had talked about? And then there was a time the National Assembly said it had approved, or it was willing to approve about 400 billion naira for the purchase of vaccines. Now later, members of the National Assembly again complained that the government has refused to bring a request for a supplementary budget. Now, do you have any information with regard to that? Why would the National Assembly be willing to make funds available and nobody will follow up, and it will be the lawmakers themselves that will be begging the government to make appropriate representations for necessary appropriation?
So thanks, Ruben. I think the first thing to say is this vaccines front really is not as simple as many people assume it is. It's a complex area, so let me try and explain it in three ways. Firstly, is the supply side, the development of new vaccines from candidates to vaccines. So we've seen almost a scientific miracle that has happened last year, and several vaccines have been developed. Some are still in the pipeline, and really that's so important to have happened in the world. There are efforts now going on that has really highlighted the deficiency in manufacturing capacity on the continent completely. So there are lots of efforts led on by the Africa CDC and the African Union to ensure that many other African countries are better placed to participate in the development and manufacturing of vaccines. So that's very important and happening. What has that led to is that there's a supply deficit. So as much as you'd like to throw money at this, whether it's appropriated, whether it's available, the challenge is that there are no vaccines to buy. The supply has been very limited. We banked on getting most of our vaccines through the COVAX facility, which then relied on India to supply most of that. And there were guarantees, but when the escalation of cases started happening in India, that supply was pushed further down the line. So we have a delay in receiving the second batch of vaccines. But what government is now doing is mitigating this delay through various other arrangements, both bilateral discussions and multilateral discussions with the African Union. So we are still fairly confident that in a month or so we will get the next set of vaccines arriving in the country. What have we done with that we have received? So the National Primary Healthcare Development Agency has been working really intensively with the states and managed the 4 million doses, more than any other African country that we received. Just under 2 million has actually been administered, and the rest has been kept, the other 2 million, to make it 4 million, to make sure that everyone that got the first dose gets the second. So, you know, in some cases, Lagos just announced they got a few extra doses last week. So we've been managing this to ensure that we match supply and demand. At the same time, NPHCD has been very active in countering a lot of the, you know, sometimes negative statements made by people in society that you not really expect this to be coming from. But so far, we have managed the available supply. We have been big voices in the international space saying that, listen, the current level of access to vaccines globally is a shame to the global community, that we cannot accept a world where such a large part of the global population simply doesn't have access to vaccines because of an ability to pay. So there are big global efforts going on at the moment to make sure that there's a larger access, more equitable access, actually the best word, to the global population. And this doesn't only affect Africa, it affects many other countries in South America, Southeast Asia, across the world. But I think the one thing to end with is saying what we're really, in the short term, the challenge is supply. It is not a problem that money can solve. It is not a problem that the Senate can solve. It is a challenge that we must keep working through bilateral and multilateral efforts to get hold of vaccines. And I know that the Minister for Health, the ED of NPHCD are working day and night to get this. Then we have a medium-term challenge to solve. How to make sure that we're never in a position like this again in the future. How do we do this? By investing in research and development, research into vaccine manufacturing, and sometimes trying to leapfrog some of the technological bottlenecks that are in place for this. And we have done this in other sectors where there's a buck to be made.
Well, on that note,
what we need to do is how do we transfer the innovation that happens in tech, in telecoms, to public health and vaccine development.
Yes, thank you very much, Dr. Ihekweazu, for joining us on the morning show and for helping us to explain the situation with the vaccination program.